My name is Dr. Robert Khoo. I'm a colorectal surgeon at Southern Ocean Medical Center, which is part of Meridian Cancer Care. I treat cancers of the colon, rectum, and anus. In fact, colorectal cancer is the third most common cancer that occurs in men and women in the United States, and the second leading cause of cancer death in the United States. In fact, this year, in 2015, it is expected that 50,000 people will die from colorectal cancer. There is effective screening for colorectal cancer. If we can find the colorectal cancer by screening, it is 90% curable, compared to only a 50% cure rate if you present with symptoms such as pain, bleeding, or obstruction. Screening for colorectal cancer should be done before you have symptoms. Generally, the recommendation is you start screening after the age of 50. That's when the cancers become more common. You want to try to find the tumors before they grow into cancers. In fact, the time it takes for a normal colon lining to grow into a polyp and then that polyp to grow into a cancer can take anywhere from 5 to 10 years. So you have a long interval during which you can do some screening. Once you're found to have a cancer of the colon and rectum, surgery is the only cure that's possible. Prevention of colon cancer depends on a number of factors. One is adopting a very healthy, high-fiber diet, avoiding red meat, and you should start this at an early age. The other key is to exercise frequently. Unfortunately, though, sometimes the cancer cannot be prevented because it can run in your genes or in the family. For those patients that have a positive family history, the screening should start about 10 years before the age of the diagnosis of the earliest blood relative. To me, the multidisciplinary approach to colorectal cancer is key. What it means is you're not just being treated by one team member, but by a team, which may include the surgeon, the medical oncologist, the radiation oncologist, a nutritionist, a psychologist, a geneticist, and maybe even other team members. The idea is to give you a unified, comprehensive approach to this cancer. Sometimes when you're given the diagnosis of colorectal cancer or any cancer, you feel lost as a patient. So it's helpful to have someone like a nurse navigator bring you through the process to allow you to see the different specialists that are involved, to visit the various centers that you may have to go to. So they're invaluable in this process. At Meridian Cancer Care, we promise to work closely with you as part of a team to give you the very best care.